it's always an honour to be here and represent the HSA, but also Dr. Alexander and I have known each other for a very long time. I arrived in 2001 and Dr. Alexander joined us shortly after as the head of the department, and it's been an honour to be working with her for all of these years, for sure. She does an amazing job. I think we should give her another clap. Okay, so my job basically was to try and keep you all awake, so you're not tiring, and to bring a little bit of humour. There's a very serious side to the role of the partner in labour, but there are some funny parts to it too. So I'm going to start with a little video. Some of you might recognise it. This is from the movie called Big Mama's Home. I don't know how to press play.
Oh, damn, that's the baby.
Will you shut up, please? Big Mama can handle this. Now get out of here.
Big Mama's here, darling. Don't worry about nothing. Okay, now Nolan, get your chunky ass in gear and find me some hot water. Lena, I need towels, lots of towels. Okay, and somebody give me some lard, preferably Crisco. We got a baby about to slide across the world.
Hold my hand, Big Mama. Hold my hand. Just hold my hand. Hold my hand. Hold my hand. I'm doing good. I'm doing good. You're doing good. What they need Crisco for?
They use Crisco for everything down here.
I breathe. I can't breathe. I can't breathe. What the hell are you doing?
Come on, Big Mama. I saw this in the movie once. Big Mama told me.
Big Mama, I think you should sterilize that. Is that sterilized?
Oh, yeah, I use WD-40 and some easy off of.
Big Mama, we not frying chicken. We're not frying chicken. Get that out of here. Plunger. Here we go.
I see something.
You see the hand?
I don't know what it is. I'm looking at this, looking back.
So I think that woke you all up, didn't it? It's an amazing movie, the whole of it, actually, if you want to see it. Big Mama is an FBI undercover agent, for those of you who don't know. Well, obviously, there is a serious side to it. What I like about this video particularly is that being a hospital-based midwife all my life, of course, this is a home delivery, which in the Netherlands, it's still about 20 or 30% are home deliveries. The UK, only 2%, and of course, in Cayman Islands, it's non-existent. But what's lovely about it, you're not seeing masks, you're not seeing gowns, you're not seeing that medicalization of childbirth, basically. It's in its natural form, where you're seeing people being supportive and being there for the needs of the woman, and making her feel secure, make her feel strong in her ability to do for childbirth, which I think is beautiful, really, I do. So my presentation basically is going to step back in time into the 1940s and then gradually come to the present day, to see how it's evolved and how the role of the partner has evolved over the years. But it's supposed to be fun, so enjoy it. It's not, I am a feminist, you know, I have opinions on men, but it's not to be disrespectful or anything like that. It's meant to be a fun presentation. So the role of the birth partner is a big responsibility. It's actually an honour, not just for the birth partner, but for me as a midwife to actually be present in the delivery room, bringing life into the world. It's an amazing job. You're invited to witness an amazing emotional and incredibly personal moment in life. It's common to choose your partner to be present at the birth, but you don't have to. If you think they might feel uncomfortable and struggle seeing you in pain, you might want to choose someone else, somebody more suitable for the job. That might be a parent, a sibling, a doula, a friend, or just even having your midwife present. But nobody should go through childbirth alone. So I was born in Yorkshire, for those of you who don't know, and I've lost my Yorkshire accent, but back in 1941, there is a movie called Love on the Dole, and basically the midwife states to the father, "Now lad, sling your hook. You ain't wanted here for half an hour and you'll only be in the way. Basically, she's saying sling your hook means get out of here, disappear, go do what you've got to do, but we don't need you. 1950s, things didn't change too much. They were the same. Post-war era, men, women, and midwives, general consensus was that men were not welcome because they were men. And men didn't want to be there because it wasn't manly. British Medical Journal, 1961. Now, this really has me laughing because we reflect on the British Medical Journal a lot in our careers, you know. We rely on what they tell us. But in 1961, they were saying, let's not pander to morbid curiosity and sensationalism, nor to those feather brains who wish to be in the van of a new fashion by encouraging a highly unnatural trend with mumbo-jumbo of pseudo-psychology. The proper place for the father is not at work. It's in the local, where the instinct will usually guide him. And that's in the BMJ, right? I thought it was hilarious. So he's suggesting you should be in the pub, having a pint, not by the side of your wife and giving her support. Oh, thank you. So 1982 to present, in 1982, Beale and Maguire noted that the medical profession has now accepted that fathers have a right, if they wish, to see their child being born. And I'll look shortly at issues regarding why we didn't want the fathers in the labour room initially. The present day, it's seen as the norm in Western culture, which begs the question, can fathers express the desire not to be present without censor? Are we actually forcing them to be there nowadays? Has it gone from one extreme to another? So thoughts to consider. And this is one of the main reasons that we didn't really want fathers in the labour rooms back in the day. When complications arise, promptness is often required on the part of the medical staff in the delivery room to ensure the health of mother and child. And that's absolutely right. You know, my priority is mother and child, not the father. Now, I've had several fathers fainting on me. I've had 30 years of midwifery experience. It's a long time, and people do have mishaps in the labour room. Mostly, you know, it's just a little wobbly knees and nothing too dramatic. But I have had a gentleman that hit his head on the delivery cart and was wheeled away to accident and emergency, and the paperwork that involved for me to fill out was quite horrendous too. So. There's no time to adapt to situations, and they can be overwhelming for both parents. In this context, there's a permanent discussion about obstetric violence, or what is perceived to be obstetric violence. I'll give you an example of a situation where everything goes beautifully, the baby comes out, everybody is just in awe of this amazing change in life. And then we have a massive postpartum hemorrhage. Your labour room goes from this very lovey-dovey feeling of very emotional and safe and beautiful to actual mayhem. You have your wife in front of you turning pale, blood, I mean, literally everywhere, like something out of a horror movie. You have complete strangers running in the room trying to resuscitate your wife, and it can turn into a very scary place very quickly. We don't really always have time to discuss what's happening at that moment. I mean, we have learned over the years that debriefing is very important, so at least now we are able to discuss it after the effect. So it's a traumatic experience that can affect the mother and the respective partners for months and even years. Sometimes we believe that having the fathers or their partners there will bring them closer together. Well, in fact, if you've been in a traumatic situation together, it doesn't necessarily bring you together. It can actually drive you apart. Partners were always seen initially as additional witnesses. An increase in malpractice suits was what was thought was going to happen. And even today, last week I had a delivery and I asked one of the doctors to come in and assess the situation for me because I wasn't comfortable with how it was going. And the father was actually videoing the whole experience. And as soon as the doctor came in, turned that video off, right? So we're still thinking of litigation. So what brought about the changes? Basically, groups like the National Childbirth Trust, the Association of Improvements in the Maternity Services, or AIMS, influential people like Sheila Kissinger, And basically, more than anything, the fathers themselves. Fathers are always present, usually in the living room while the mothers were giving birth upstairs in the bedroom, but they were there, right? And don't forget the women themselves. It's very important for the women. It doesn't matter what they do as long as they are there. That's the key, really. This one. Next one, sorry. So the role of the birth partner is described as the most profound and life-changing experience for everyone involved. Well, I think if your wife's choking you, then that's probably quite a profound experience for sure. Whether it's a spouse, a family member, or a close friend, the birth partner is essential in providing emotional, physical, and practical support throughout labour and delivery. It's actually a very huge task. So I won't actually go through these because time is of essence, but literature suggests very obvious things like giving emotional support and physical assistance, advocacy, and basically this part makes me laugh, but the needs of the birth partner. So they need to be prepared mentally and practically. They need to be informed, educated, know what to expect. They need to have gone to childbirth classes potentially. They need to know the mother's birth plan. They need to pack essential snacks, drinks, lip balm, massage tools, and they need to stay with her throughout. That's quite an ordeal of needs for the birth partner. But this part makes me laugh. Oh, go back, sorry. How do you get that to play? Well, and it is funny, but it's the reality in a lot of cases, especially nowadays with the lovely invention of epidurals. Epidurals are increasing in popularity. On average in the UK and the US, 70% of women will choose an epidural for pain relief in labour. So there's not much mopping brows and massaging backs and things like this that's going on necessarily. A lot of the time, women and partners are encouraged to rest, especially if it's in the middle of the night, get some sleep, save your energy. Benefits of companions in labour. Studies have shown that having a companion promotes respectful care. Women greatly value the presence of someone they can trust. This support is said to make them feel safe, strong, confident, and secure. It's arguable that it reduces the duration of labour, but I'm going to look at something that suggests otherwise. It reduces the amount of analgesia required. Well, actually, some research suggests that if you've got a less emotional intimacy with your partner, then actually you're going to experience more pain. So if you've come in labour after just having an argument with your boyfriend or your husband or whoever, then you're going to feel it. It apparently improves the overall birthing experience if they're there, but we've just talked about mental health, and if your relationship's not on sound footing, then maybe their partner being there won't necessarily improve that experience. It might make it worse. And improves the likelihood of vaginal delivery. Well, as I say, from the 1970s to the 1980s, we had an increase in cesarean section rates as well from bringing patients into hospital and the medicalisation of childbirth. So the likelihood of a vaginal delivery, given the increased C-section rates, is also questionable. So as I was just introduced, I worked for 2 years in Pakistan on the Afghanistan border with refugees. The evidence to action brief by the World Health Organization recognised the importance of a companion of choice during labour improves quality of care, and I would argue that is absolutely spot on. But when you look at many healthcare facilities not actually permitting women to have a companion during labour and childbirth, and a lot of cultural and religious norms, Pakistan is a good example. I worked in a facility that was a 10-foot high wall with a gate that a security guard used to sit on, And if you were male, you were not going through those doors and you were not going into the area where all the females were. It was very much a cultural thing. And whether that needs to change or not is questionable. The people in Pakistan, or the tribal people, were very happy with that concept and maybe didn't want to change that. What is known, not just in everywhere in the world, as the World Health Organization suggests, is raising awareness. We need to make everybody aware of what choices we have, not just in childbirth, but in life in general. You know, we need to know what's out there. We need to share information. We need to give out posters, leaflets, that kind of thing. We also need to influence changes in attitude, even at this level, you know. We need to create an enabling policy that promotes choices for women. And we need to make formal changes to existing national and international policies. The biggest issue we have is optimizing physical infrastructure. Obviously, our hospitals were built several years ago, and things have changed. Not only now do women want their partners to care for them in labor or be there even just, but they want to stay overnight. They want early discharge. They want to have better care in the community. There's a lot of things, but we need to listen to what our women want and actually provide the service that they're requesting. Basically, Patrick O'Brien don't know much about for sure, but he's the Vice President of the Royal College of Obs and Gynae. This was in line with what I mentioned earlier, when women need to feel confident, safe, strong, when their partners are present. And it doesn't matter what everybody goes through. From Patrick's experience, most people will not say that they'd wished they'd stayed at home. Although it can be a traumatic experience, the men actually say, no, it was worth being there for them. I'm rushing through time, so that's why I'm not reading it. And the next very interesting switch for Michel O'Donnell was very famous when I was training as a midwife. But in 1977, he introduced the concept of having home-like birthing rooms. So when the woman came into hospital, she would feel more at home, more relaxed, and more secure, more safe, this kind of thing. And his argument is that oxytocin, the love drug, is a shy hormone that won't come out when women are surrounded by people and technology and anxious husbands. He states, I'm more convinced that the participation of the father is one of the main reasons for long and difficult labours. He also noticed something akin to postnatal depression in many men who have been present at birth, some even taking to their bed complaining of everything from a stomachache or migraine to a 24-hour-long bug. There was a study in Germany in 2016 asking their fathers it was a study just for the gentlemen. Fathers found their attendance at delivery was beneficial. The mothers thought it was beneficial. And they thought that the relationship benefited from them being there. But fathers felt helpless. They felt overwhelmed. They felt fear. And they felt traumatized. I think this ties into the obstetric violence side of things as well, if you're not necessarily prepared. They said that the gentleman didn't actually go on to develop post-traumatic stress disorder and did actually choose to attend the next delivery, so they got over it, bless them. Another study in France, nearly finished. First-time fathers need more professional support to foster positive experiences of childbirth. Their experience of childbirth are associated with considerable worry. Antenatal classes, specifically fathers, could reduce their worry and support the fatherhood process. I don't know if that's a thing for the future, but it's definitely something they're considering in France and Switzerland. So to conclude, during childbirth, a woman is the mercy of a special situation due to the nature of childbirth, including the experience of pain and sometimes the first confrontation with hospitalization and medical intervention. As men often participate in the birth of their own children, this event represents a fundamental turning point in the lives of both women and men. Medical staff in the delivery room have a great impact on the well-being of fathers and mothers. Therefore, fathers' needs should be kept in view. Because of the diversity of family constellations, all partners should be included in further studies, especially same-sex partners. Any questions?